to the Adoption Lounge. I'm Amanda.
And I'm Katie. Thank you so much for joining us again. We have another story to tell. But first, I would like to complain. I would like to file a formal complaint that my dear friends have decided we should once again attend a haunted house this year. And I just want you to know, when we went last year, I handled it poorly.
She paid extra so they wouldn't touch her.
I did. I paid extra. And this really, I don't know if I've ever talked about this on the podcast before, but I think about this all the time. This really nice woman in line, maybe in her 60s. I'm sure she's just volunteering for fun.
Right.
And she was like, "Are you okay?" I must have looked like I was about to pass out. And she was like, "Listen, honey, you can do anything for 30 seconds. And every single room is only 30 seconds. And I think about that all the time. I apply that to everything in my life. Anytime I'm having like a panic attack about anything, I'm like, you know what? You can do anything for 30 seconds. It will at one point be over.
Who knew that at a haunted house you would get a life lesson?
That was the year we almost lost Calais.
She was in the coffin.
She was in the coffin. I don't know what's going to happen
I got put
this
in the
year.
electric chair. You almost lost me, but I guess we won't bring that up.
I forgot about that. Sorry. It's the coffin that sticks out in my head.
Yes, because it was the ending.
Equally concerned, more concerned about you.
Thank you.
Can't live without you.
Seriously.
But anyway, they're going to make me do it again this year, so.
Yeah, we're really excited about that. We're also excited about having Megan on. We're going to get to hear her story. Megan, why don't you introduce yourself?
Hi, my name is Megan, like you said, and my husband and I are actually in the process of adoption. We are on that journey after our 3-year-long dramatic and traumatic journey. And I also want to mention I am a licensed clinical professional counselor, and I do a lot of work with children who are adopted, children who are in the foster system, and then women who've experienced any kind of pregnancy trauma.
Yeah, that's so cool.
Yeah,
that's
it's
awesome.
incredible. It really is.
Do you feel like that, like you were doing that work before, so do you feel like that's something that made your heart more open to adoption?
You know, I've always been open to adoption. I've always loved kids, and that's originally why I went into the therapy field, because I noticed there was a gap in the way we were caring for children. A lot of it was mental health related. So I've always been attuned to that and I've always been interested. But then when we started having our journey, which of course you don't expect, then I was reminded of like, oh yeah, like this is something that I think could be really wonderful.
What was the process like trying to find what company you were going to choose to partner with?
It was scary and overwhelming.
Yeah.
Right. And, you know, you have to be on the same page as your partner. And my husband is absolutely fantastic, but we're definitely two different thinkers. So I'm very emotionally driven, which makes me a better therapist, I think.
Right.
Hopefully. And he is very analytical. So he had his choices, I had mine, and then we really worked together to find what we thought would be best. And we had talked to Amanda several times. And that was also helpful, just feeling like we could ask all of our questions.
Yeah. Sure. I'm more like you, so I totally understand that. And I think there's something to be said about women's intuition too. I think this is something we've really honed over the years. But I think that for me, it's always about a gut check and how I feel about something. But I agree. My husband is very different. I don't know if we always marry each other just to make life more interesting. I mean, it's good to have a balance too. But.
I was going to say, I think it's cool to have the balance because I think if you're both emotionally driven or you're both very analytical, it doesn't always, sometimes making decisions, because I feel like you need both to make the right decision.
Yeah, you need someone who's ready to pull the trigger.
Somebody that's ready to go for it, but somebody that also is like, pulls it back a little bit and is like, well, let's just think about these things. Let's just make sure we're on the same page.
Yes. So I am the one who's definitely like, okay, you thought about it for a while.
Right.
It's time to just do it. So like you said, it works out very, very well.
Yes.
Yeah. Aww.
So how did it feel starting it? You guys decided that you were going to join. What was that process like?
It was really, really exciting, of course nerve-wracking, but very, very excited to get started with this process. I think with so many things out of our control for so long, it felt like we could finally start something that feels more productive. Maybe that's a weird way to say it,
No,
But
I understand that.
yeah, that felt maybe a tiny bit more in our control. We also got to this point where like we cannot be more ready for a child. We've done everything that we wanted to. Are further in our careers, are financially stable, we have our home, and we just want to get there. And any child that we bring into our home, our bio child, adopted child, we know we are at the point that we can give them the best possible life.
Yeah.
I know we usually have everyone tell their adoption story, but because we get to have you here and because of your background, we are hoping to kind of also get to talk to you about, questions I usually get from families that are kind of thinking beyond just the adoption process and actually looking into raising this child. What kind of conflicts do you see in a lot of adopted children? Are you seeing any kind of overarching theme or something that you can kind of help parents who are wondering about this be better about helping them kind of from the start?
Yeah, it's the number one concern for sure.
Yeah.
Yeah, also, I'm sorry, my cats are going to try to be the star of the show.
Oh my gosh,
Oh,
yes.
I love kitties.
I'm fine with that. We both are cat and dog people. We are animals.
Okay, good. So you understand. We have 3 of them. So they can get.
Oh, we have 4.
And cats just
I
live
have
their
4
lives.
cats.
Oh,
Not
God.
we, as in we're
We have together.
together we have 6.
Together we have.
Uh-huh.
Yes. Sorry. Math is not mine.
Yeah, it is mine.
Benny's kind of mine too, because I'm going to steal Benny at some point.
Benny's my Siamese cat. So
Ooh, Siamese.
He's not Siamese.
beautiful. He is Siamese.
He just looks Siamese.
He is Siamese.
Oh.
He's definitely Siamese.
He's no, he's
Okay,
not.
I'm gonna send you a picture. Yeah.
He's in a litter with a lot of other siblings that are like, he's like a regular cat. He just has coloring like a Siamese.
I think he's Siamese.
I'm gonna
send you a picture.
I'm gonna send you a picture of what a Siamese cat looks like.
Well, you could get him tested and then prove, like,
I
Yeah,
am.
let's definitely
I'm
do
gonna
that.
do that.
I can't wait.
Siamese?
We'll announce the results on the podcast.
We'll be waiting.
But I'm sorry. So, who are your cats? Also,
Okay,
You have 3.
so Duke is our oldest. He's 14 pounds, which when we went to Costa Rica, we found out that
Big boy.
he is bigger than the average sloth. So I was
That is amazing. That's amazing.
I feel like that's just helpful data too.
Honestly.
right. So and it's really in tune with his personality, I think. And then Pickles is our middle one.
I love pickles.
I'm really jealous of that cat name.
Yes, everybody loves Pickles, especially just with the name. And she is so tiny, just this tiny, fragile little.
Pickle.
Well, you have to have 2 also. Like, I also have a gigantic cat and a very petite and sweet and lovely
She has a
cat.
fat cat.
Yes. She's,
Fluffy.
she's fluffy.
But yeah, we don't body shame our cats.
Yeah, she's
exactly.
fluffy.
Exactly.
She's fluffy.
My husband does.
But she also doesn't do anything. So what do you expect when you just lie there?
That's very true.
Yeah.
And
We
then
call her
our
Fat Nesta. But it's like Fat Amy. Like, it's just from Pitch Perfect.
right, it's you accept it.
Exactly. I don't think she's ever seen the movie. She probably doesn't know.
But your third cat.
Our third cat is Cooper. He's sitting right here, and he's right in the middle. He's like a sturdy medium size.
Oh, he understood the assignment.
Yes, he fits in perfectly. We always describe Cooper as like a few fries short of a Happy Meal.
Oh my gosh.
Oh, yeah,
I've
that's-
never heard anyone, Megan. I have never
That's
heard
not-
somebody else say that, and I say that all the time.
Really?
It's not worse than
A
Fat
few
Nesta. I'm
fries
just saying.
shorter than a Happy Meal.
That's
Yes.
not nicer than Fat Nesta, okay? We are both shaming our cats.
This is true.
There needs to be
This
equal
is true.
accountability
It's in
here.
a fun way. But
Yeah. He can't do anything that cats should be able to do. Like, he's really clumsy. He falls.
they're supposed to be like angelic. Like they're just
Yeah, that's how Karina
and
is.
yours
but-
is just falling over.
Well,
So
Nesta's really large, so
it's like a tipsy kitty.
yeah. I've seen her steal an entire piece of pizza though, so
Oh.
That's impressive.
it is impressive. I'm almost like
Although if you've seen the size, it's like I could see her take it down. like she
so if you're a few fries short of a Happy Meal, it's because Nesta took them.
yeah. Nesta's
I'll
been
tell
to
you
your
where
house.
those French fries went.
I didn't realize this was also going to be comedy. Good for you.
I mean, so off the rails.
This is
I'm
our
so
this is our
sorry.
best podcast yet.
But Cooper, on like a more serious note, Cooper was so helpful because he's so just funny, the stuff he does. So when we have been grieving, he's been fantastic. Like after, which I'll get into later, after my second miscarriage, he had me laughing the same day. So they've just been incredibly important to us. And they have no idea, of course.
Yeah.
Well, they're cats, so they also don't care. So
yeah.
No.
Don't.
Aw, that's really awesome, though. I love that. So I'm sorry. Back to my brilliant question.
Yeah, back to our brilliant question.
Yes. So there is a frequent misunderstanding with parents, whether they are adoptive parents or their kids are biological, where I think people have the expectation that kids are supposed to be little adults.
Mm-hmm.
And that's just not true. Parents will come to me and be like, well, my kid only wants mac and cheese. What do I do about that? Or they're having tantrums. They can't regulate their emotions. And sometimes the simple answer is like, you have to remember that they're children and that's okay. And then we look at paired with that, when you have a child who's been in foster care, who's been put up for adoption, there is that innate trauma that we have to think about, and that can create further dysregulation. So if parents don't have the mindset or the awareness of that going into parenting, it can be really hard to kind of retrain that. And that's a huge part of what I do, is working with the parents.
Well, and I know I feel like gentle parenting is something that's kind of misunderstood, because isn't the theory kind of behind gentle parenting more about understanding the level of self-regulation that children are actually able to do and modifying your behavior to show them kind of how to begin regulating?
Yeah, and we use the term co-regulation, which is really important, that the parents and the child are doing that both ways.
Mm-hmm.
Yes, and the gentle parenting, like you said, there is some misinformation about that, and I think people will be like, well, our kids need to have structure and discipline, and that's not what gentle parenting is discluding. I'm a huge fan of structure. I'm a huge fan of boundaries when raising a child. We just have to do it in a certain way that doesn't create fear or belittling that can stick with the kid for years.
I agree with that. 100%. I think some people do think when you hear, but I think there's extremes, right? And everything, but you hear gentle parenting and people think that you're just kind of like letting your kid just do whatever because they have feelings. You know what I mean?
Exactly.
And it's like, there's no structure and no discipline. Just let them feel their feelings.
No one's ever in trouble. There's no consequences for any
There still needs to be
actions.
structure and consequences because kids, I feel like, need that.
Yeah.
I mean, adults need that. We need that.
Even my son, he had, and I don't mean to call anybody out here, but he had a rough time last year without making any progress. He has Down syndrome and he's in a self-contained classroom. And I feel guilty sometimes because I don't think I realized how little structure he had in his classroom until we got a new teacher this year. And she is very structured and he's doing amazing. And like, it's never a disinterest. He doesn't really have any behavioral issues, not knocking them, but he's just a much more introverted kid. So you don't see him throw tantrums or really have that many antics. But I mean, to see him make progress and be happy to go to school and excited, like it's just a totally different world. And I'm like, wow, I didn't realize how much of a difference it made. It made me feel upset with myself for not.
Well, you don't know what you don't
but
know.
you don't know what you don't know. I know.
And
but
comparatively, you don't know that. Like sometimes you just think this is the way that the classrooms are.
Exactly. And I didn't
And my
realize
kid needs to adjust to that.
And I didn't realize he was unorganized either. Like I didn't. One of the aides was kind of like, "Oh yeah, she's really organized, and like that'll be a nice change." And I was like, "Oh, I didn't really realize we were in a place where we weren't." But I feel like that translates also to the home, I would think, and kind of figuring out what your child needs and having that structure, and it has nothing to do with not, being gentle with that more.
Well, what's like a tip? What's a tip that you would give parents, that you would tell a parent that was maybe struggling with regulating emotions especially with an adopted child?
Yeah, an adopted child. I'm adopted as well, so I'm curious. It's fun.
For sure.
She wants to find out if her mom did a good job.
Yeah, I'm going to report back immediately to my mom.
Yeah, you can give her my email. We'll talk.
I'll be like, you
Donna.
didn't do a great job, but
Donna,
if you could reach out to
meet
Megan.
Yeah.
Here's
kidding, she's the best.
unsolicited advice because everyone loves that.
Yeah,
Oh,
right.
it's everyone's favorite.
So, acceptance is so important. If your kid has a bad day or a bad hour, every day is a clean slate. You're coming back and giving that child acceptance, unconditional love every time. We're not holding a grudge against the child. Because we have these boundaries, we're implementing them, and ideally they're collaborative. Once the child is able to think on that level, making sure that they're collaborative so it doesn't feel that things are just decided for the child, but then making sure we're accepting the child no matter where they are at and validating whatever emotions they have are presenting with, if that makes sense.
I
Yeah.
love that collaborative. I think that's interesting because when your kid gets
Yeah.
older, it's you can talk to them more, right? And they understand more and comprehend
And
more.
listen to them more, probably.
Yeah,
too.
so it's easier to be like, okay, here's the behavior that's not okay. Can we do better moving forward? And what do you think what's a fair consequence in your eye?
Yeah.
And it's interesting. You'll learn a lot about your kid too to see how they respond to that.
Yeah. Well, and can I ask you too? This is a question we get a lot, and I obviously have an answer just because I am an adoptee, but I think it's always nice to hear from someone who's a professional. We get asked sometimes when to talk to your child about being adopted, and my answer, of course, is always from birth. But if you could kind of speak on why that's so important, I think that's always a really helpful thing to go over.
Yeah, and like I said, I'm a really big fan of making kids feel like you're not keeping secrets from them. Of course, we're not putting money troubles on them, we're not putting marital issues on them,
Right.
nothing like that. But whatever they come to you with, you are going to accept them in that and help them with that so they know 10 years down the road, I can come to mom and dad for anything, no matter what. So, in my professional and personal opinion, having that open conversation, I think, can be really, really important. Not to mention, it opens up the no matter who you are, no matter where you came from or your background, we love you and we're never going to stray away from that acceptance.
That's really true. I never really thought about it like that. I guess by keeping the secret, I always thought it was just really damaging because they would feel, or I guess I would feel like you had kept something from me that was so integral to who I am as a person. But also, I guess it kind of creates an area where you might feel like maybe they didn't like that about you as a person or accept that about you as a person as much subconsciously.
There's a reason why you kept it. So
should I
take
feel
that on?
shameful about
Yeah.
it because you didn't want me to know?
Well, you're also creating a big moment in their life that they're at a crossroad where what they thought was true is not true, and now they have all these new questions
Yeah.
and dealing with that, but also the emotion of
There's an
figuring it out.
instability about that.
Yeah.
I feel like.
Do you have any advice on maybe how parents should go about, like, should they talk about it always right away and it just be always something that, because I know that's what Katie says.
Yeah.
Do you think they should wait till they're a
Validate
certain
me, Megan.
age? Like, what, in your professional opinion, what do you feel?
I think it depends on the kid. I think it depends on what is best for the child at this time. And I think it really comes to how do they handle their emotions? How do they handle big news?
It's frozen.
Can you hear me?
Oh,
Yeah,
now
sorry.
we can.
It
Sorry,
just
it froze
for a minute.
Oh no, that's totally fine. It hopefully it's not on my end. Yeah, so I think it depends on the child because every child is different cognitively and emotionally. But anytime we're giving kids big news, books are the best thing to do, especially with younger children. Reading a book together, and there's now so many books out there. So
Yes.
yes, if a sibling is diagnosed with something that's chronic, they're diagnosed with something that's chronic, you're moving, even if you're going on a big vacation, divorce, you lost a loved one, books are a really great way to guide parents and make children understand at their level.
Yeah.
Yeah. We have such I think
do
we did
have
an
a list.
episode about all the
Yeah, and we have some lists, but if you
do you have a
some, I
favorite?
would love to. Yeah, do you have a favorite? And I would love for you to email me some. 'Cause
Yeah.
we can use that as a resource. But is there a favorite that you have, like one that comes to mind?
Off the top of my head, no. I guess there is a book that I'm thinking of right now that not specifically is about adoption, but is about full acceptance and everyone is welcome. It's called No Elephants Allowed.
Yes.
I actually have heard of that.
Yes.
Yeah.
It's incredibly beautiful about how everyone is accepted no matter who or where you come from.
Well, that's great because that'd be a great book for everyone, and it has multiple meanings in it. Because
Yeah.
obviously, an adopted child can, there's a lot that's for them, but even
Yeah.
every kid should. I'm gonna like
Yeah.
kids read, like it's going in my
Gabby's like,
Amazon
I'm
cart.
19.
Gabby's my daughter's gonna be like, I'm 19, mom. I fully accept everybody.
Everybody's getting one for Christmas. No, I like that.
Yeah. Yes, it's huge.
So, Megan, talk to us about the waiting period a little bit, if you don't mind. I know that you're in the middle of your journey right now. How has that been? Do you have any advice for other parents who are going through this right now, who are waiting?
I think a lot of parents will love hearing this because we talk to people who have adopted. So sometimes they're looking at their journey after there's been success. So I'm interested to hear your experience while you're in it.
How's your mental health?
Oh, that's
Well, she knows
That's
somebody
a
that
very
can help her
loaded
with
question. Thank you so much.
yeah, you don't get as a therapist very often. Um, so just to kind of touch on our journey a bit, if you don't mind me sharing some of
No,
that.
not at all.
About a year after we had gotten married, we started trying. And then I did get pregnant, and we found out, I knew very quickly that something was wrong from the start. And that kind of became the beginning of a lot of emotional invalidation from medical professionals, unfortunately. And that's something I talk a lot about with my clients who are struggling with this or any kind of chronic illness. But once we were able to get our ultrasound, which happens around 8 weeks, right? You have that wait a bit. I found out that I was having a miscarriage. Right. And we were like, okay, I'm going to get the required surgery and then we're going to try again. We're like, okay, bump in the road. And then I didn't get my period. 10-week wait, I didn't get my period. They had me do a second surgery. And then my gynecologist ended up sending me to an oncologist, a gynecological oncologist, because I was diagnosed with something called gestational trophoblastic neoplasia, which I know say that 3 times fast. It's
I
called
couldn't say it once.
Yeah, I was just
So,
going to say that. I was like,
I'm
nope.
in my head thinking about how you just got
Like,
through that.
You win.
So, yep,
I fold.
you're my hero.
That's terrible, though. I
Yep.
don't know anything about
I
that.
don't know. I've never heard of it. So, do you want to explain a little bit about what that is?
That's really important to bring up because any doctor that I saw, they were like, we learned this a tiny bit in medical school. So I need to look that up. I need to talk to another professional. So it is.
That's why it's really reassuring.
Yes, I appreciate the honesty, but it just reminds you of how rare it is. So essentially, it starts usually with a molar pregnancy, which means that instead of a baby forming, it's partially an abnormal mass. So it can be a full molar where it's the full mass, or it can be a partial molar where it's half and half. When a DNC is used, which is to remove, it's a surgery to remove pregnancy tissue.
Right.
Usually that fixes the problem. That takes away the mass and it's fixed.
Okay.
But when we have a persistent mole, it becomes this mass that becomes cancerous in your uterus. It's just persistent. It keeps going.
Wow.
And if not treated with chemo, it can spread to your lungs, it can spread to your brain.
Wow.
That's so wild. And it's like
It's like a
created.
wildfire
It's like
in
you
your
created
body.
your own cancer, though. Like, that's so
Yeah.
weird. Like, bodies are so weird and scary, and especially because no one really knew to check for it. So
Right,
blame
and then
my
you're like
husband.
wondering if they're confident in now the treatment plan.
right.
Well, and if you think about, like, we're an hour from Chicago, we have some of the best doctors in the entire nation, if not the entire world. So to hear this is really scary and makes you feel really special in a terrible way.
Yeah.
Worst
Yeah.
way.
Probably not the way you want to feel special.
No. So I ended up doing 3 months of chemotherapy, which was infusions, 1 week on, 1 week off. And the
That's
chemo-
aggressive.
yes, the specific chemo they chose for me was methotrexate. And it's supposed to be one of the chemotherapies that has light symptoms. I did not experience that. So I lost
God.
about half of my hair, and a big symptom with that is mouth sores. So if you've ever had a canker sore,
Oh my
think
God.
about that
Horrible.
times like 1,000. So my entire mouth and like down my throat, my tongue covered in mouth sores where it's really hard to eat anything, even liquids.
Oh my gosh. I can't even live a normal life with one. I've
Exactly.
had one before.
That's horrible.
And I'm like, this has taken over my entire life. I
Yeah.
can't talk. I don't want to eat. So to have it covered and then your throat, I mean,
Yeah.
that
Yeah,
had
it
to
was,
be absolutely miserable. And there's
yeah,
nothing you can do. There's no treatment
I'm
for
also a
that.
huge stress eater, so that's how I make myself feel better.
That would have been
Can't even
horrible
do
for
that.
you. Yeah.
Yeah.
and a
That
good friend
sucks.
of mine, we were talking before I'd started treatment, and we were laughing, like, oh, mouth sores, like, that's so funny that that's a symptom. And then,
Like, ooh. And then you're like, never mind.
never mind,
Just
it's
so
not,
you know, it's mouth
Yeah,
sores.
we were wrong. It is
Yeah.
terrible. And
it's
man,
not funny at all.
did it kind of like slowly develop? Did it just gradually go away? I mean, that's so
Yeah,
awful.
did it stay the whole time through the 3 months that you were on chemo and then go away gradually once you had stopped treatment?
It's really interesting because the weeks that I was not doing the infusions, that's when the mouth sores would come.
It's so odd. You would think it'd be the
Oh, and
opposite.
so then they would kind of fade and then come back.
So
And
just
then
when you started to feel better, you would get them again. You're like,
yes,
here we
yes.
are again.
It's like torture.
Yeah. That's
And then
horrible.
eventually they did go away several weeks after I'd stopped chemo. But I went to the dentist actually recently, and she goes, "You still have a ton of scarring in on the inside of your cheeks," and this was
Wow.
3 years ago. So
Wow.
that kind of gives a
That
picture
shows
of
you how much. Yeah.
Can you
right.
feel it, or do you think you've just gotten used to it and now you don't
Yeah,
know?
do you have more sensitivity because of it, or because
No,
sometimes when you have scars it's more sensitive.
I had no idea until she had pointed that out. But it's just a
Well,
reminder
that's
that I
good.
have so many scars on my body that
Yeah.
taken so long to go away or continue.
Yeah.
Yeah. You have a lot of scars that tell a story for sure.
Very much so. And then
Did
we
you
had to wait a
turn?
year. Oh, I'm sorry. Go ahead.
No, I was just. I mean, you're gonna keep going anyway. I was just gonna ask you if you decide to turn to adoption after that experience, or
Yeah, right away we had to wait a year. That was the medical protocol after finishing chemo. You had to wait a full year before trying again, which was a long time, and we were feeling so stuck. So then we started talking about adoption because we wanted to start our family more than anything. So it was a
Yeah.
year of just waiting. So I think that that conversation really began during that time.
Yeah. Gosh.
I'm
And
so sorry that happened to you, Megan.
It's wild.
Sucks. Yeah.
and
Absolutely wild.
so did you decide to try again once that year was up, or did you make the decision during that you were just going to pivot completely and do adoption?
We wanted to try at least one more time,
Okay.
naturally. And the doctors were really reassuring. There's no reason that this should happen again. There's no reason you should have another miscarriage. And I did.
I feel like the doctors are always reassuring, and I don't
Just
appreciate
nice.
that. No, I feel like, and I don't mean to, like, yes, of course you want them to be reassuring, but I sometimes feel, especially when it comes to fertility things, that unless they're literally looking at like a 0% chance of it working, they're always like, why not? Why not just try again? Like, let's just do it again. And I just think it's irresponsible sometimes.
Well,
But
with
that's
fer-
just my opinion.
well, with fertility, I feel like percentages are always low. They're actually lower than what you would think. And because I never
Yeah.
realized that until people were telling me about it with IVF. And I'm like, gosh, that's so crazy that people, will take that little percentage, but it's hope, because
Totally.
it
But
has
I
to
also
work for
feel-
somebody,
I
right?
feel like they're just not discouraged at all in any way. I feel like it's
That's
not
true.
fully realized the risks that
They're
are
not
involved.
aligning expectations
Because it doesn't
fully.
cost them really anything, and it's costing women especially, but men too, so much. I don't know.
Yeah.
I just feel like sometimes women and healthcare can be a really tricky area.
Yeah.
And they see it every day. So they become desensitized to it.
Yes.
But every time for us, we lost our baby. And a quote that I really like is when you lose a parent, you lose your past. When you lose a child, you lose your future. So
I've never
that
heard
is
that before.
it's really encapsulates how it feels. Encapsulate.
Yes.
There we go.
I was with you still.
Yeah.
So, did you, once you had that miscarriage and grieved that, when did you become ready to, how long after that did you and your husband decide, okay, let's try to keep moving forward and do adoption?
It was a point of contention for us because
Mm-hmm.
we were just really stuck in that grief
Yeah.
Yeah.
and that trauma. I was definitely ready to jump on board just because of, like I said, the way that I emotionally think about things, just compassion based and connecting with people. And in his mind, analytically, it was like, let's try one more thing. And that is something that we talked about for a very, very long time. So I think that is when we started definitely looking more into. Every year it got like more serious and
Yeah.
an increase in reaching out and getting resources. Then we tried IVF just because that's kind of the
The natural next step.
yes. And I was like, okay, this is it for me. I said, like, my body has been through so much. And spoiler alert, did not go well. I I am 31. So, and at the time when we started this, I was 30, so relatively young, as we know.
Oh, I feel like you still feel like at 30, all like I had my son at 30 and I was like, I am so young, all the possibilities are still ahead of
Oh,
me.
sure.
You know.
Right. And our fertility doctor, after we got our eggs removed and we get them PGT tested, which means you test for chromosome issues,
Mm-hmm.
because that's the main reason that a miscarriage is caused. We
Right.
had 5 embryos tested. Not a single one came back viable.
Wow.
And our doctor said, I have never seen this happen to someone as young as you.
Wow. That had to be something that probably took a minute for you to accept
Process,
and
yeah.
process.
I had never felt so broken at that point.
Yeah.
That was supposed to work.
Right.
And it didn't. And that's when I said to my husband, I was like, I want to start the adoption process. And he's like, yeah, I understand.
You know, I think well, not think, I know, we have a lot of families that obviously are doing adoption because they've dealt with a lot of loss and they're grieving and trying to move forward. What advice would you give or tips that you would give, maybe things that worked for you or even in your professional opinion, just how people should, or not should, or could work through
Yeah.
those emotions? Because I think it's difficult and a lot of people haven't dealt with it before. Sometimes you don't even know anyone that's dealt with it. So
Yeah. What helped you and Drew have some of those conversations?
I'm really lucky in the relationship that I'm in where we have great communication and we're able to balance each other out, like was what we talked about in the beginning. But I'm actually going to give you a very structured answer to this because I realized a gap in the research that we have and the grief modalities that are used in the therapeutic world, because there's the general grief, but with this kind of loss, a different, more specific kind of grief therapy needs to be used. So I kind of simplified what I found to be helpful, and I call this the 3 I's. So here's the structure. Isolation. We have to be really, really careful of isolating ourselves. So take the time that you need, of course, after any kind of loss or even beginning adoption and the long process that it can be and the difficult process. But avoid isolation as much as you can. Reach out to people, a therapist, get the support that you need. I always remind people that anxiety and depression thrives in isolation. So that's number 1.
really good.
Such an isolator.
Yeah, get the resources that you need, right?
Yeah.
And then invalidation, which I talk about all the time, as I mentioned earlier, If we are invalidating our emotions, whatever we're feeling at the time, it's going to go downhill. Right? We have to really meet ourselves where we're at and validate whatever is coming up. If we deny any of that, the grief process is going to get worse, at least in my experience working with clients.
Yeah.
And then finally is inflexibility. And this one's really tough. It definitely takes some time to get there. But if we have an experience that is hard to adapt to, I think we have a choice of how are we going to see this? How are we going to view this that keeps us from remaining stuck? And I think the best way to describe this is an analogy. I call myself the analogy queen. So here's my analogy.
We love a good analogy.
Oh, yes. Metaphor, analogy, do it all.
So if we have a piece of paper and we write down our goals in life loves to like take it, rip it up, and just throw it out the window. Whatever. Crumple it up. Life, that's a hobby of life. And then we have a choice there, like I said. Okay, can we take this crumpled piece of paper and turn it into something useful? Can we turn it into a paper airplane? Can we turn it into a paper crane? Some kind of origami, something that is beautiful, whatever that looks like for people. For me, that became advocacy and awareness. That was my step in adaptability and decreasing the inflexibility in the grief and the trauma.
Yeah. I think that's really good advice. And, not to keep picking your brain, but you're in the waiting, and between the two companies that we have 100 waiting families. So I would love to hear what things have been working for you in being successful in kind of navigating the wait for you and for your husband, because I think a lot of families would benefit from any suggestions, any advice.
Yeah, I think Drew, my husband, Drew and I both kind of delve into things that make us grow. So for me, that was really furthering my education, furthering my career. I'm always taking continued education courses, to continue that education and just grow as a therapist. For Drew, that was projects around the house, adding things to the house that just made it better, more enjoyable, working to pay off my student loans.
That'll take some time.
Focusing on how can we make sure we're in an even better financial place. So focusing on what you can and personal growth, because I keep the mindset of as the further we grow, that's going to be so much better for our children in the future.
Yep.
Yeah. Absolutely.
I love that advice, because I think there's lots of projects and stuff that you can do. I try to tell people to kind of live their life too. And I love that you're doing things that feel like you're setting yourself up for success once an adoption does happen. So it feels like you're, like you said, you're doing what you can control. I love that.
Yeah. And thank you so much for talking to us today, Megan. I have to tell you, I'm going to have so much fun following along your journey. And I hope you'll come back and talk to us and share your adoption story in the future.
I would love to kind of gather some questions from families and maybe have you back on and you can kind of work through those questions, because I feel like you have so much knowledge. It'll be fun.
All right. Well, that's the fire alarm in our building.
Oh, fire alarm's going off. So here we are.
So fun.
So on that note,
thank you so much.
Thank you, Megan, so much.
And I hope everybody joins us again next time if we don't burn in the fire.
Yes.
Probably just testing.
It's just testing.
Yeah.
There's really not a fire. We wouldn't just be sitting here.
We just got so into talking to you, I lost track of time.
I didn't even realize what was going on.
Yeah. All right, listen, thank you so much, Megan, and we'll talk to you soon, okay? Send us a list of books.
Yeah, send us a list of books.
Yes, for sure. All right, thank you guys. Bye.